Hello, this is Dr. Stanley Lang. Welcome to this video. And the subject of it is how John lost 91 pounds in 2 years. And John is a diabetic patient that I have been seeing for about 2 years. And there's some elements of his story that I think are helpful to people who are on the journey of trying to lose weight or trying to reverse diabetes. So John came to my office as a new patient after being in the hospital for an unrelated reason. And there he discovered that he was diabetic. And there they wanted to put him on medication. They wanted to start the standard things that are started for diabetics. But he wanted to talk to me first. And so we reviewed the options. And so I told him, you can do plan A, which is follow the usual diabetics program, which is for him would have been 2 medications at least, in addition to a statin drug, and a diet called the ADA diet. Or you can do plan B, which is our low glycemic index diet that we've been teaching for more than 20 years to patients who either want to lose weight, want to lower their blood pressure, want to reverse diabetes, or at least control it with less medicine. And so he elected to do plan B. And he was very, very faithful. We met on a very regular basis for monthly for a while, then every 3 months. And he has done excellently. And so he's lost 91 pounds in the last 2 years. Now, most of that weight he lost in the first year. So his weight loss has kind of slowed down. And he has initially was almost ketogenic. Now, he was never fully ketogenic, but he was almost ketogenic. Now he's much more my usual low glycemic program, and he's been on that for some time. Now, when he was diagnosed as diabetic, his A1C was only 6.9, which is not super high for a new diabetic. And that's actually would be considered pretty good control for the average diabetic, but it was high enough for him to be diabetic. And the thing is, he was able to drop it all the way down into the mid-5 range 6 months by exercise. So the program that he's following now, his A1C has been 5.0 for the last 2 times we've checked it. Now, 5.0 is lower than most people wandering around out there who are supposedly normal. Now, unfortunately, most people who are supposedly normal are actually pre-diabetic, so their blood sugars are running a little bit higher than they ought to, and their insulin levels are a lot higher. So they're in severe insulin resistance. They have all sorts of cardiac risk factors that they don't know about. That might be you. You're sitting on a time bomb. If you're not taking steps to reverse your insulin resistance, which is basically what John has successfully done over the last 2 years. And the point I wanted to make, the last point I wanted to make about John is that he has sustained this for over 2 years. And I have a lot of patients who have done that. So this is a program that is not a flash in the pan. It's easy to do. It's actually easier to do long-term because it's not hard to maintain it once you start it, because you feel better and it's not hard to eat this way. And it's not boring either. You just have to give up some foods, obviously, or you're not going to change anything. So if you want to make this change, you can. You can. If John could do it, you can do it. So I wish you well. God bless, and have a great day.